After foot surgery, there is a need for us to maintain movement of the joints in question. Now, we may not do this immediately after the surgery, but we will instruct you as to when we would like you starting joints moving. There are a couple of things to deal with. Firstly, the great toe. Now, most of the time when we've done surgery for the great toe, we are enthusiastic to maintain movement up and down. If there has also been deformity, perhaps of this sort initially, then we would like to aim to stretch that deformity away so that it doesn't recur. Now, if we were to do a procedure to regain movement of the great toe, we will instruct you to move this joint. This is called the MTP joint. And the idea is that you grasp the great toe not at the tip, because there's another joint in there, but rather just there, which is just before that knuckle. So the exercise with the great toe, grasping the toe before the mobile joint in the middle of itself, and then bending the toe down, holding it right down, 5 seconds, and then let it come up again. Just bend your knee, Nikki, if I could, and just let your knee sit up a little bit. So the idea is we take the toe, bend it right down, and then right up again. And then after we've corrected deformity, which may have started, for instance, like this, we're keen for you to take the toe in the same position and stretch it across. Hold it in that position 5 seconds or so, sometimes using the index finger of the other hand, just to support this part of the joint, and then relaxing. It's not necessary to stretch this side, and we don't want you to do that because we've repaired structures on this side. The next set of exercises involves the lesser toes. These exercises are a little difficult to achieve on your own unless you have very good knee movement. The principle is the same as the big toe. We are aiming to move the joint that is deep in here, which is the same joint as this one. The difference between these toes and the big toe is that the big toe has one joint, whereas these joints are two. So we locate the joints, and then we hold the toe right down here, and we bend down, aiming to bend that joint there. There's no point in bending that joint there, or this one here, because it's not what we're trying to achieve. Once again, we would like this done at least on an hourly basis.